Today I'm going to be demonstrating a neurological assessment on my patient here. So we will be looking at the level of conscious and cognitive ability, the cranial nerves, and then the sensory and motor functioning as well. So like any assessment, I'm going to begin by doing my hand hygiene, introducing myself, and asking permission. So, hi, my name is Elizabeth. I'm a nurse and I'm going to be performing a neurological assessment on you. Are you okay with that?
Yes.
Okay. I'll explain everything as I go. Can you start by verifying your name and date of birth, please?
Bob Ross, May 19, 1980.
Okay. And then the first thing that I'm going to do to start off the assessment is to just ask the patient some questions to get a feel for their alert and orientation status as well as their cognitive ability. So I can see right now that he is awake and alert, he's upright, and he is responding to my commands and is able to speak appropriately. And then his overall appearance, again, he's sitting upright, he doesn't look disheveled, he doesn't have any major like tics or anything going on, he's pretty calm. And then I'm going to just ask some questions. We already asked your name. Can you tell me where you are?
In a room? At the hospital.
Can you tell me what hospital are you at?
Mercy Hospital.
Okay. And why are you here today?
For an exam.
Yep. And can you tell me the date in the year, what year it is?
It's 2023, September 28.
Okay. And then can you tell me who the president is?
No. George Washington.
Okay. So that just proved that he is alert to person, place, time, and situation. So all those questions were answered appropriately. Next, we are going to look at cognitive ability. So there is a test you can do for this called the Montreal Cognitive Assessment. I'm not going to go through that today, but I'm just going to look at some basic things, a short-term memory, long-term memory, and then I'm just going to ask like a simple math question and a simple word thing just to kind of get some cognitive ability to see how you're going there. So I'm going to give you a phrase, and then in the next couple minutes I'm going to ask you to repeat that. So the phrase is, I want to play baseball today. Okay, so we'll come back to that. And then looking at the long-term memory, I'm just going to ask you a question from your past. What color suit were you wearing on your wedding day?
Navy.
Okay, and if they can recall that, the long-term memory is intact. And then I'm just going to ask you simple math questions. Can you count to twos up to 20?
2, 4, 6, 8, 10, 12, 14, 16, 18, 20.
Okay, good job. And then I'm just going to ask you I'm going to name a category, and I'm just going to ask you to name things that fit in that category. So the category is clothing. So can you tell me some types of clothing?
Shirt, pants, shoes.
Keep going.
Hat, underwear, jacket, shorts.
Okay, good. So normally you'd kind of time it, see if they could, do it for 15 seconds or whatever. And then can you repeat that phrase I said to you earlier?
I want to play baseball today.
Okay, awesome. So that concludes the cognitive portion of the assessment. Next we will move on to the cranial nerves. Okay, so moving on with the cranial nerve assessment, we'll go through each cranial nerve and how to assess that. And what it is. So cranial nerve number 1 is the olfactory, so the smell nerve. So what I'm going to do is just have the patient plug one nostril and then have them smell in the other, and then vice versa. I just have a candle, but like an essential oil little stick or something that's more localized would be a little bit better. So go ahead and just plug one side, yep, and then tell me if you can smell this. Okay, and then the other side. Can you smell that? Okay. And then moving on to cranial nerve 2, which is the optic nerve. I'm just going to grab my light here. So I'm going to look at the red light test and look at the structures in the back of the eye and look behind the pupil at the optic nerve. Once I get this turned on. So I'm just going to be standing here. If you could just look straight ahead. And then it's just going to be a bright light in your eyes. And then I'm just going to come in at a 15-degree angle and see that red light, and then look behind those structures at that nerve. Okay. And then cranial nerve 3 is the ocular motor, which will look at the constriction of the pupils. So I'm just going to shine a bright light in each eye and just notice for the pupil constricting. So just look straight ahead again. And then it's going to be a bright light coming in. Okay, and then the other side, look up a little. Okay. All right, and his pupils were equal, round, and reactive to light. The fourth cranial nerve is the trochlear, which is the gaze in the eyes. And so we are going to look at movements in all 4 quadrants of the eye. And this actually uses nerves 3, 4, and 6 all together to look at this. So I'm just going to have you follow my finger up and then down and over here and up again. Cranial nerve 5 looks at the trigeminal, the sensory, and the motor. So it's the jaw area. So for this to look at the sensory, I'm just going to use a Q-tip that has a soft touch. And just say, can you feel this? As I kind of push it down his face. Yes. And then just kind of turn to the side a little so I can show. And then the same thing over here.
Yes.
Okay, and then for the motor portion of it, I'm just going to place my hands on his jaw and have him just clench your jaw. Okay, and then move your jaw side to side. Okay. Cranial nerve 6, the abductus, we already talked about with the eye movements, looking in the gaze. Cranial nerve 7 is facial movements. So I'm just going to have you smile for me, frown, and then puff your cheeks out like a monkey. Yes. So that tests the facial movements. And then cranial nerve 8 is the acoustic. So I'm just going to do what we call the whisper test. You can also kind of test this just by having a normal conversation with the patient and that they're not saying like, huh, and what every 2 minutes. You kind of know that their ears are working, but I'm just going to whisper a 2-syllable word in his ear and then have him repeat it. Baseball.
Baseball.
Yellow.
Yellow.
Okay. And then the next cranial nerve is cranial nerve 9, the glossopharyngeal. So this is the ability to swallow. So some patients who have like had a stroke or something lose that ability. So I'm going to have you just swallow for me. Okay, and I'm just looking that those muscles in the neck are moving appropriately with the swallowing. And then I'm also going to examine the soft and hard palate and look at the uvula to make sure that it is midline. So I'll take my light again and just open your mouth and say, ah. Okay, stick your tongue out for me. Okay, so I'm just noticing the uvula is midline, then off to the side. And the soft and hard palate moves with his movements. And then cranial nerve 10, the vagus was also part of cranial nerve 9, so it's the same test for both of those. Cranial nerve 11 is the spinal accessory. So what I'm going to do, that's like movements of the shoulders. So I'm going to place my hands on his shoulder and have him shrug up against it. So just shrug your shoulders. Okay. And then also is movements of the head. So I'm just going to place my hand here and have you turn against my hand. Okay. And then, okay. And just noting that it's equal on both sides. Both shrugs and both head movements are the same. And then the last cranial nerve is cranial nerve 12. This is the hypoglossal. So this is sticking your tongue out. So I'm going to have him stick his tongue out at me and just note if it's midline. If it's deviated to the right, it could mean that there is an injury on the right side of that brain, that cranial nerve. And then same with the left, it could be on the left side. So go ahead and stick your tongue out for me. Okay, and it is midline. And that wraps up the cranial nerve portion of it. Next, we will move on to the motor. You're just so low. I need you to be higher.
It's like tilt. Okay.
To begin the motor part of the assessment, the first thing that I would have noticed kind of when the patient just walked into the room would have just been his normal gait, his walk, to make sure that his stance is appropriate, his posture was good. Noticing any like tics or gross musculoskeletal deformities. He walked in very smoothly, and again, he's sitting in an appropriate way. The next thing I'm just going to look for is any muscle atrophy. So I'm just going to kind of look at the big muscle groups, the biceps, the triceps, the legs, and just kind of note, you know, does it feel like he has any obvious muscle loss in any of these? So I'm just going to kind of feel that out. And then same thing with the legs here. And then the next thing I'm going to do is just some passive range of motion. Just looking for overall tone and just see, like, is he really rigid? So I'm just going to kind of move your arm up and down here, in and out. Same thing with this arm. So I'm just noticing, is he rigid? Is he really like spastic with his movements? Is he totally flaccid where he has absolutely no strength to hold himself up? And then I'll do the same in the legs. Just noting just some range of motion here, just kind of gently moving his legs and feet there. Moving on to some of the strength parts, the first thing I'm going to do is assess the hands. So what I'm going to do is have you hold your hands out. Yep, and then I'm going to kind of squeeze the fingers here and then try to open your fingers. Okay, and you should feel some resistance. And then the opposite, fan your fingers out, and I'm going to try to push them in, and then just try to resist me. Okay, and then next, go ahead and make 2 fists, and then I'm going to try to break your wrists, like push them down, and try to fight against me. Moving on from the hand strength to the elbow strength, I'm going to have you put your arms out like this. Yep. So with your arms out like this, I'm just going to push down and then try to, bless you, and then try to resist me pushing down. Okay, and then the opposite, I'm going to push up. Okay, and then I'm going to test the adduction and abduction in his arms. So with your hands like this, I'm going to squeeze and then push your elbows out. Okay, and then the opposite, pull them in against me. And again, you should just be feeling some resistance with that. And then moving on to the lower extremities, I'll kind of zoom in and show you how we kind of test for the strength, the resistance, and the dorsiflexion, or the abduction and adduction with that. So with the patient's legs dangling off the exam table, I'm just going to push against his shins and have you push out, and then the opposite, pull your legs back in. And then the feet, we're going to do the same thing. So pull up, yep, and then point your toe down. Okay, and then the same on this side. And I'm just noting that the sides are both equal. If one side, or if they're both a little weak, that's different than if one side's weaker than the other. So that's kind of what I'm noting with the strength there. For the next portion of the exam, we'll have the patient laying. We'll be checking the hip strength. So what I'm going to have you do is I'm going to come over to this side here and just kind of bend your leg just a little bit for me. Okay, and then I'm going to push down on your thigh, and you push up against me. Okay, and then the opposite, the hamstring, and on the other side, same thing. Push up, again, just noting if the sides are equal and what the strength is. And then with your knees bent, I'm going to have you adduct your legs, yep, pull them out against my resistance, and then pull them together. Okay, and then I'm just going to check the rotation of the hips. So I'm just going to have you kind of go like this, yep, and then push up against me. Okay, and then the opposite. Excellent. The next part to the motor neuro assessment is going to be balance and coordination. So we're going to start with the balance test. There's a lot of different balance tests that you can do, but I'm just going to do a simple one and have the patient stand and then close your eyes. And then just note if he is able to balance like this, if he's drifting one way a lot, one way or the other, and I'll kind of stand here just in case he does lose his balance. Okay, you can open your eyes. And then the next test is similar. It kind of looks at coordination. So I'm going to have you do the same thing, but I'm going to have you hold your palms out like that. Yep. Okay, and now close your eyes. And what I'm gonna do is I'm gonna push down on his hands kind of hard and fast, briskly, and then they should return up to their normal position. Okay, here. Okay, one more time. Okay, you can open your eyes. So that just kind of, that's the Romberg test and then the pronar drift test to see that he can do that balanced without drifting, and that his hands can go back to the extended position. So the next thing we're going to look at is the gait, so the walk. Again, we kind of looked at that when he was walking into the room, but we're going to kind of look at that a little bit more closely. So what I'm going to have him do is just kind of walk in a line forward and back. First, just a very normal walk. Okay, so just go ahead and walk in a straight line this way. So again, I'm just noticing that his gait is normal. He's not swaying or using one side more than the other. Okay, and then the next thing we're going to do is have you walk heel toe in a straight line. So the patient will walk heel toe, and you'll just notice balance, you'll notice the coordination. Is he swaying? Can he do it? Okay, and then back. Perfect, and then the last one we'll do is you will walk on your heels. Yep. And this looks at the strength and coordination in the feet. And back the other way. Okay, and then walk on your toes. Excellent. For the next part of the exam, you're going to have your patient slap the thighs and then lift your hands up and pronate them, and then slap your thighs with the back of your hand, and then just do that quick, okay, and then just kind of as fast as you can. And what we're noticing with this is the smooth movement of it. If he did have a brainstem injury, he would not be able to perform that. And the last test we're going to do for the coordination is the point-to-point movement. So what I'm going to do is hold my finger out and then have him touch his fingertip to mine and just move it all over. If he had a brainstem injury, I can't say that, he would not be able to coordinate that movement. So go ahead and just touch my, you can open your eyes, the sun, touch my finger, okay, and then touch your nose in between. Sorry, I forgot to mention that. Yep. Okay. Excellent. So that concludes the motor portion, and next we will be moving on to the sensory portion of the neurological exam. During the sensory portion of the examination, you can test the senses in a few different ways, and you kind of want to look at all of them to get a good picture. You can use sharp and dull, pain, temperature, and a tuning fork like I have here. And you'll want to do this on various parts of the body, so I'll demonstrate. But first we're going to start off with just a couple more generic tests. The first one is called the Stagger Stenosis, and what I'm going to do is put a familiar object in the patient's hand with their eyes closed, and they're going to tell me what that object is. If they had a brainstem dysfunction, they wouldn't have the proper impulses for their brain to detect what that familiar object is. So go ahead and close your eyes, and then I'm just close them. You cheated. I'm going to put an object in your hand, and you can feel it and tell me what that is.
Comb.
A hair comb. Good job. And then the next one we're going to look at, it's called graphothesis. So I'm going to just in the palm of the patient's hand just write either a number or a letter and see if they can figure out what I'm writing. You're up too high, I can't see you. So just hold your palm out and close your eyes and just tell me what number this was.
4.
Good job. And then the point localization will be the next part of the exam. So what I'm going to do is have the patient close their eyes, and then I'm going to touch an area on their body and then have them touch after me to see if they can figure out where I'm touching. So go ahead and close your eyes. And they're usually not exact. Ooh, that one was. But they should be kind of in the ballpark of where your touch was. And then the next one we will do for sensory is the extinction. So this is to be able to tell what side of the body I'm touching. So a lot of times with stroke patients, they can't perform this test. So what I'm going to do is just have you close your eyes and tell me if I'm touching the right or left side.
Left. Right.
Okay, and then when I do them together, this is where a lot of times stroke patients have the issue of they can only feel their strong side. So tell me what side.
Both.
The test touch, the first thing I'm going to do is test just light touch on the body. So you can use something like a Q-tip or like a Kleenex, something soft. Okay, so with my tissue, I'm just going to have them close their eyes. All these tests really should be done with their eyes closed so they don't know, obviously they can't cheat by looking. And just tell me yes or no if you can, or yes when you can feel something.
Yes. 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 Yes.
Okay, and then have your hands out. So I like to do just kind of like the major groups here, and then
Yes.
on the hand, and then I like to turn the hand over, and then just do kind of each individual
Yes,
finger.
Yes. Yes. Yes.
Okay, and I would do that on both sides. And then to test kind of a sharp, I'm going to use a broken Q-tip and just kind of use this kind of pointy side and just do the same thing.
Yes. Yes.
And then again, all the
Yes.
fingers,
Yes.
just kind of sliding out
Yes.
in the face. Again, noting, do you feel any differences on one side versus the other?
Yes.
Do you feel any differences on one side versus the other?
No.
Okay, you said yes.
I'm still,
I know.
I'm still saying yes. Yes.
Okay.
Yes. Yes.
Perfect. And then I would also do the lower extremities. So I'm just gonna move your pant up a little bit here. So you can do the soft touch and then just kind of, yep, tell me when you feel it.
Yes.
And then each of the
Yes,
toes.
yes.
And again, I would do that on both sides, and then I'm also gonna do it with this sharp.
Yes. 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 Yes.
Okay. And then for the temperature test, I'm just gonna start down here since we're already down here. I just have a cold tuning fork that I ran under cold water to make it cold. Usually you want to tell the patient that, but have them close their eyes and then tell me, is this hot or cold?
Cold.
Hot or cold?
Cold.
And the same on the upper extremities, hot or cold?
Cold. Cold. Cold.
Okay, and then as long as I have the tuning fork in hand, we will do the vibration for it. So what I'm going to do is strike the tuning fork and hold it on a bony province on the patient, and then have them tell me if they can feel the sensation and then when it goes away. Take your hand here.
Yes.
Okay, and then tell me when it goes away. You can open your eyes for this one because you can't really see. It's okay. Do you still feel it? The vibration?
No.
Oh, okay. So next time just tell me when you don't feel the vibration anymore.
Didn't understand that one.
Sorry, I should have explained more clearly. Okay, do you feel this? Vibration?
Yes.
Okay, tell me when the vibration goes away.
Okay. Right there.
Okay, and then I would do the same on the feet and toes as well as I did on the upper extremities. And you can also do it on the face here too. Just make sure that the tuning fork is on like a bony portion. And you can, if you're doing an assessment on someone who is like complaining of sensation loss, obviously you're going to be more focused on that area, or someone who's like diabetic and might have neuropathy, focus on the feet, stuff like that. But for a general one, you want to hit all the spots. The last part of the sensation test is called the propiotation test. So what I'm going to do is have the patient hold their hand out, and I'm going to just move their finger up or down or left or right and have them tell me if it's going up or down or left or right. And you can do the same on the toes as well. So go ahead and put your hand out, close your eyes, and then I'm just going to move a finger. Tell me what way it's going.
Up. Down.
And then the same thing on the feet. With the toes, you can relax that. I'm just going to take your foot and just move your toe.
Up and down.
Good job. And then I do it on both sides and obviously compare the two sides. And while I'm doing all of these sensation tests, it's important to ask if it feels different on one side versus another, comparing the two sides, as well as just overall, can they feel it or not feel it, or is it really weak to feel? And then the next part of the neurological assessment is going to be the reflexes. So I will demonstrate where and how to test for reflexes. We rate them on a scale of 0 to 4. 0 means a reflex is absent. 1 means diminished. 2 is a normal reflex finding. 4 is brisk. 3 is brisk. And then 4 is brisk with clonus, which I'll explain what that is. Okay, so I just grabbed my reflex hammer. There's also weighted reflex hammers that you can use, but this should be good for this test. And how we're going to use it is just kind of in a wrist flicking motion. So we will look at a few different reflexes. Starting with the bicep reflex, we're going to have the patient just relax their arm out. And then I'm just going to put 2 fingers. You're going to kind of feel this tendon. Put 2 fingers right over the tendon and then just strike that and watch their arm move here. Sometimes just a thumb. And then you see just some movement in the hand here. So that would be a 2+ reflex. The next one I'm going to look at is the tricep. So this is just, kind of rotate your arm to see here. So you're going to feel for this tendon kind of right here. And then just relax this arm. Just let me kind of take the weight of it. Okay. Okay, and then you can see the arm movement. The next one we look at is the brachialis, the forearm. So there's the tendon just kind of right here. So go ahead and just relax this arm. Okay. Let me just move your arm up a little, yeah. So we're gonna hit that and then watch the arm flex. And then we're going to look at the patellar and the Achilles. And now we're going to look at the patellar. So with the patient's leg dangling, make sure that it's not on the ground and that they aren't having to work to keep it up. So sometimes if they're taller, they have to be on a higher chair. So you're just going to kind of feel right on the knee here. And then again, just kind of using a flick of the wrist motion, do that, and then watch the leg. And again, on the other side, always comparing side to side. Okay, and then we're going to look at the Achilles. We're going to find it in the back of the leg here. So yeah, I'm just going to have you pull your pants up a little and then just relax. And you'll see the foot flex. And then what we're looking for with clonus is if the feet have beats in them. And so what I'm going to do is just kind of flex this and then just relax your foot and it should just drop smoothly. If any of these reflexes cause that jerkiness in any of them, that's called clonus. And that's when you would get that 4+ reflex. We are now going to look at the 2 superficial reflexes, the plantar and the abdominal. So for the plantar, with the feet here, I'm going to just take them and kind of just scratch with, I'm just using the back of this. So I'm just going to scratch up the foot. And then the toe should curl in when I do this. Yes. The foot invert and the toes are drawn downwards. That is a good sign. If the toe kind of goes, if one toe kind of goes up like that when I do that, that would be a negative sign. For the superficial umbilican test, we're going to do kind of the same thing where I scratch the skin and then just look for flexions in the muscle. And depending on what area I do it in, I always move towards the umbilicus. What can depend on what cranial nerve is affected. So I'm just going to kind of scratch and just watch the stomach kind of contract in. Okay, and I can do it from the sides here as well. And you're sort of looking for that flexion. The last thing we're going to look for on this assessment is the meningeal irritation, and then there's 2 different ways that we can do this. The first is we're going to look for Babinski's sign. So what I'm going to do is just have with the patient just laying flat in bed like this, I'm just going to kind of grab his neck and curl it up. If he remains flat, he has a negative sign. If he has to like kind of bend his knees and flex his hips to kind of compensate for that, it could mean that there's some irritation or some meningitis. I'm just gonna grab the head and then pull up. Perfect. And then just go ahead and demonstrate what it would look like for a positive sign. So just kind of bend your knees a little as I'm doing that. Yeah, I'm kind of get the idea there. And then the last test for the meningeal irritation is the kerning sign. Okay, so with the patient laying flat, I'm going to just kind of bend a leg and then lift it up. And then do you not have any pain in the spine with this?
No.
Okay. So that would be a negative sign. So if you did have pain in the spine with this kind of motion and then kind of bringing the leg up, that could also mean that meningeal irritation. And that concludes the neurological assessment, including the reflexes, the sensory, the motor, the cranial nerves, and the level of consciousness. And that will be a full assessment that you would do on your patient for a good neurological exam. Thanks for watching.